Hi, I'm Dr. Tim O'Carrigan from Limb Reconstruction Service, New South Wales, and I'd like to talk about flat foot deformity. So the flat foot is where the arch to the foot is flat or reduced, and it's very common. In fact, there's a normal range, so most people have a normal arch, but some people their arch is flatter, and some that's called a flat foot deformity, and some their arch is higher, and that's called a cavus deformity. And there is a wide range of what's normal, and there's a lot of people running around in the community, playing sport, very active, pain-free, who have flat feet. Where people run into problems is where the deformity or the flat foot deformity is more severe, or sometimes in older patients they can develop a tendon problem that can lead to imbalance. So when you have a balanced flat foot deformity and flexibility, then patients do well. When you develop imbalance and malalignment, which becomes severe, then that can lead to pain. In this patient's case, he has had flat feet all his life, but he started to develop pain because of increasing deformity. One of the drivers of that is a tight Achilles. And you can see that when you look from behind, the heel is off to the side, that's called a valgus heel. And also when you look from the front, the foot is externally rotated relative to the ankle. And you can see that on the plain x-ray, the foot is rotated out around the talus. And when you look from the side, the arch is completely collapsed. One of the problems that can occur is with a tendon called the tibialis posterior tendon, and that can develop degenerative changes. That means that it stops working properly. That in itself can cause pain, but then the structures, ligaments on the inside of the ankle lose their dynamic support and they can stretch out, and that can lead to increasing flat foot deformity and pain as a result. So part of our treatment for a flat foot deformity can involve a tendon transfer of a tendon called the FDL, and we can transfer that in and take over the job of the tib post. It has to be done in association with other procedures, which can include a heel shift, and we do that keyhole, shifting the heel over so that it's sitting more directly under the tibia and reduces that valgus. The Achilles lengthening is done through a small incision on the inside of the calf, and we're releasing the tendon part and leaving the muscle part. That's called a striatal release. And finally, another technique is to lengthen the lateral column, and that involves a cut in the heel bone and distraction. We put bone graft in there, and that brings the foot around so that it's lined up with the tibia. So there's a range of procedures that are necessary, sometimes all of them, sometimes part of them, depending on the individual patient and their requirements. And this is an example here. You can see where we've corrected it with the x-ray. That's the heel shift, the lateral column lengthening. And there's another osteotomy here called the cotton osteotomy. All of these are aimed at correcting that malalignment and relieving pain. And this is a before and after on the left side. We haven't operated on the patient's right side in this circumstance, so that's still deformed. Correction of alignment helps relieve pain, maintain function, and improve the patient's quality of life.